autism is a priority. We've gone from 1 in 10,000 now to 1 in 31, 1 in every 20 boys. This is 1,000 times more impactful to our country from an economic point of view, from a moral point of view. Autism alone, just one of these chronic diseases, will cost our country $1 trillion a year. We have to end that. We don't wait 2 years to react to a measles epidemic, and we should not, or any kind of infectious disease. We shouldn't have to do that for diabetes or autism.
The National Institutes of Health is reportedly assembling a massive autism data registry under Health and Human Services Secretary Robert F. Kennedy Jr.'s leadership. CBS News on April 22nd reported that the registry will track autism cases using private health data from federal and commercial sources. The plan includes linking data from pharmacies, hospitals by the Department of Veterans Affairs, and insurance claims databases. The registry will also include smart device data and genetic test results to create a broad research database.
So, Secretary Kennedy, you have a lot of issues on the MAHA agenda, obviously, and I'm very curious if you could share some of the logic of choosing, for example, autism and food dyes and things as some of the kind of inaugural issues that you're coming forward with.
I would say, we're in a triage situation now, so we're choosing our priorities based upon the issues. Food dye is just a no-brainer. Nobody wants to eat petroleum. Everybody knows there's enough science out there that we know it's terrible for you. That causes health problems, but also behavioral problems. And so we can act on that now. Anything that we can act on, we're going to act on immediately. Some stuff we need science for. We just need to do more science. But a lot of times you hear people say, oh, we're going to do more science on that, and then 10 years go by. That's not going to happen. President Trump wants dramatic change. President Trump wants dramatic change in the next 2 years, and we're going to deliver that for him. In terms of autism is a priority. We've gone from 1 in 10,000 now to 1 in 31, 1 in every 20 boys. This is 1,000 times more impactful to our country from an economic point of view, from a moral point of view, from just from the perspective of just our national well-being. That it has to be. It's costed by 2035. It's going to cost us, autism alone, just one of these chronic diseases will cost our country $1 trillion a year. We have to end that, and we have to end that because the children and the families are suffering so terribly. So that has been a priority for me for 20 years, and it will continue to be a priority, and we are going to find the answer very, very quickly, and we're going to eliminate the exposures that are causing it.
NIH Director Jay Bhattacharya reportedly said that the aim is to consolidate fragmented data and avoid redundant federal spending. Bhattacharya said Kennedy's study would give selected researchers access to the most comprehensive autism dataset ever, as per CBS. The Centers for Disease Control and Prevention said autism is rising fast, with 1 in 31 children diagnosed in 2022, compared to 1 in 150 back in 2007-2000. Kennedy attributed the rise in autism to environmental causes, a controversial stance many experts dispute. The federal government's purported plan to track Americans who have autism, which social media users have referred to as an autism registry, has sparked backlash. Critics fear this database could lead to the misuse of private medical information and the unfair targeting of individuals. However, the NIH says all patient data will be protected and de-identified, but many remain skeptical about privacy safeguards.
I'm going to go over some of the key numbers from the ADDM report. Overall, the autism is increasing in prevalence at an alarming rate. The study tests 8-year-olds who were born in 2014. And by the way, these studies are 2 years later than they should be. And one of the things that we're going to do as we move this function to the Administration for a Healthy America, to the chronic disease, the new chronic disease division, is we are going to have updated real-time data so that people can look at this, so Americans can understand what is happening with chronic disease in this country in real time. And I'd have to wait 2 years to react. We don't wait 2 years to react to a measles epidemic, and we should not, or any kind of infectious disease. We shouldn't have to do that for diabetes or autism. The ASD prevalence rate in 8-year-olds is now 1 in 31. Shocking. There's an extreme risk for boys. Overall, the risk for boys of getting an autism diagnosis in this country is now 1 in 20. And as high in California, which has the best data collection. So it probably also reflects the national trend, 1 in 12.5 boys. One of the things that I think that we need to move away from today is this ideology that the autism diagnosis, that the autism prevalence increases, the relentless increases, are simply artifacts of better diagnoses, better recognition, or changing diagnostic criteria. If you look at Table 3 of the ADDM report, it's clear that the rates are real. And so I want to just read you some of a little excerpts from some of the older studies. The baseline for autism in this country was established with the largest epidemiological study in history, a study of all 900,000 children in the state of Wisconsin, children under the age of 12. They found 0.7 children had autism in every 10,000. That's less than 1 in 10,000. Today we're at 1 in 31. That study also confirmed the 4-to-1 male to female ratio. There were at that time just over 60 children in Wisconsin with autism. And today it's around 20,000. In 1987, there was another exhaustive study, a peer-reviewed study in North Dakota, set out to count every child in the state with a pervasive developmental disorder, including autism. That study meticulously combed through every record, every diagnosis, and he even conducted in-person assessments of the entire population of 180,000 children under 18. The autism rate they found was 3.3 per 10,000. So that's in line with the 1 in 10,000 that was found in Wisconsin 17 years earlier. For context, today, the last number of 1 in 36 is 83 times higher. In 1987, out of every 1 million kids, 330 were diagnosed with autism. Today, there are 27,777 for every million. If you accept the epidemic denier's narrative, you have to believe that researchers in North Dakota missed 98.8% of the children with autism. That thousands of profoundly disabled children were somehow invisible to doctors, teachers, parents, and even their own study. The same researchers who followed the original cohort for 12 years to double-check their number, they went back in 2000 and found that they had missed exactly 1 child. So doctors and therapists in the past were not stupid. They weren't missing all these cases. The epidemic is real. Between 1959 and 1965, researchers from 14 hospitals associated with major universities undertook the National Collaborative Perinatal Project, tracking 30,000 children from birth to age 8. This was no half-baked survey-based analysis. The study conducted 9 separate screenings covering neurology, psychology, speech, language, hearing, and visual function. Every developmental quirk, anomaly, and disorder was logged with painstaking detail. Autism, a condition characterized by profound impairments in social communication and behavior, would have stood out like a neon sign. There were 14 cases. That's 4.7 per 10,000. So we know what the historic numbers are, and we know what the numbers are today, and it's time for everybody to stop attributing this to this ideology of epidemic denial.